As a pelvic floor physical therapist, I get the question all the time on if internal exams and internal work is necessary. And now I posted a video explaining that pelvic floor physical therapists do internal work and do go internal, like vaginally. But I did not want that video to come off as it's necessary and a requirement, because I don't, for one, it's absolutely not a requirement. It is just a tool in our toolbox that we use to help assess certain things. But there's many other ways to assess certain things. I've definitely had patients before that have trauma and different experiences where they do or don't feel comfortable, and that is totally okay. Like, if you go to pelvic floor physical therapy and you do not feel comfortable with internal work, that is totally fine. Your physical therapist should be able to meet you where you are at, because there is so much more that we do outside of internal. And honestly, I don't even do that much internal because I don't think it is necessary majority of the time. But when people do learn that we do it, and it is a part of pelvic floor physical therapy, for some people, they're very taken aback because it's just not talked about. I think the biggest thing is like people going to pelvic floor physical therapy or refer to pelvic floor physical therapy that really don't know much about it, especially if the gynecologist or anyone hasn't really explained anything, which it's not their job necessarily, but I do think there should be some discussion that is had before they actually see us as pelvic floor therapists. But regardless, end of the day, internal work is not necessary and is not a marker for success. There is so much patient education that goes into it, and so much that we talk through before even if the person is okay with it doing an internal exam. But please don't let that deter you from pelvic floor physical therapy, because just tell them that you don't want internal work, and that is totally fine and should be totally fine. And if it's not fine with them, then that's a red flag and you should go find another physical therapist. Let me know what other questions you have.